Welcome to short videos. I'm Dr. Rajita, faculty of NEXTFELLOW. So the case study which we are going to study now is regarding a 26-year-old male is brought to emergency department after motorcycle accident. Vital signs are stable, but there is a visible upper extremity abnormality, and X-ray imaging shows a fracture at the middle third of the humerus. The point to be noted here is middle third of the humeral shaft there is a fracture, and here there are symptoms are like wrist drop, sensory loss to the dorsum of the right thumb. So these are the keywords with which we can guess the answer. So the options are radial nerve, median nerve, ulnar nerve and axillary nerve. So here one thing we have to note is middle third fracture means the nerve which is in relation with the middle third of the humeral shaft is the radial nerve, which is located in the spiral groove of radial nerve, and damage to the radial nerve as it supplies all the extensors of the forearm. So there will be a wrist drop, and it also gives a superficial branch which is a sensory nerve which supply dorsum of the right thumb at the anatomical snuff box. So the answer is the radial nerve. So let's talk about little more about the radial nerve. So the root value of the radial nerve, it involves all the roots from T1 to C5 of brachial plexus, and in axilla it is related to third part of axillary artery. Then it enters the lower triangular space to reach the spiral groove. So the fracture is here. So in the case the fracture had occurred here. After this, the radial nerve related to the lateral epicondyle of humerus, and then it passes through the supinator muscle. And it also gives off posterior interosseous nerve and superficial branches of radial nerve. So sensory innervation of radial nerve is posterior surface of lower part of arm and forearm, and also the lateral part of the dorsum of the hand and dorsal surfaces of lateral 3.5 digits excluding the nail blades, and especially a small patch on the dorsum of near the dorsum of the thumb, which is called as anatomical snuff box. So in the case we have seen this point to be noted. Motor supply, it provides motor function to the triceps. So the nerve to the triceps is given off in the axilla and in the spiral groove. So as it is given off in the axilla itself, there won't be any loss of extension. So the person will be able to do extension because long head of triceps is spared. But other muscles like supinator and extensor muscles of hand will be paralyzed, and which allows the extension of metacarpophalangeal joints and extension of the wrist. So that's why we saw wrist drop. So why not the other nerves in the choices? So the main key terms which you have to note for the median nerve, it is characterized by pain and tingling sensation of first 3 digits, and the deformity there is ape thumb deformity, and common syndrome is carpal tunnel syndrome. Ulnar nerve, paralysis of wrist, and finger flexion is fingers would be like flexed, finger flexion is lost, and ulnar claw hand, and ulnar nerve often gets entrapped under arcade of Struthers, which is a Struthers ligament, forms at the cubital tunnel, that is at the medial epicondyle of humerus, and ulnar nerve may also get compressed at the near the wrist, that is at the Guyon's canal at the wrist. Then the radial nerve, here it is classically known as Saturday night palsy, injury to the radial nerve especially at the spiral groove, and associated with wrist extensor paralysis. So there will be wrist drop and finger drop. These things you have to note. And wrist drop would be spared suppose if the radial nerve injury is at the level of elbow, that is just above the level of elbow. Radial nerve gives a branch to extensor carpi radialis longus, which helps in the extension of the wrist. So there will be a weaker extension, but there won't be any wrist drop. So this thing has to be noted here. Then radial nerve entrapment can mimic the lateral epicondylitis. This thing also should be noted. And if the posterior interosseous nerve, which is a branch of radial nerve, if it gets entrapped in arcade of Rossi, arcade of Rossi is at the supinator. We know the posterior interosseous nerve passes between the two heads of supinator muscle. So if it gets entrapped at the supinator, so the arcade of, that is called arcade of Rossi, and then the patient's symptoms will be purely motor, there won't be any sensory loss. So that thing you have to note down. And wrist drop may not be there because extensor carpi radialis longus is there to do the wrist extension. So the classic sign, compression of radial nerve at the spiral groove is, of course, wrist drop. Thank you.